Somewhere right now, a man is standing alone in front of a mirror, doing something he would never admit to another human being. He is measuring himself. Not out of vanity, but out of fear. Fear that he doesn't measure up, quite literally, to some invisible standard he never actually saw written down anywhere. And here is the strange part. That standard doesn't really exist. Not the way he thinks it does. What he believes is normal has almost nothing to do with what science actually shows. So today we are going to walk through one of the most searched, most whispered, and most misunderstood topics in men's health. Not to shock you, not entertain you, but to finally replace anxiety with actual data. Because it turns out the gap between perception and reality here is one of the widest in all of human psychology. Let's start with a number that surprises almost everyone the first time they hear it. Researchers studying male body image have found that the overwhelming majority of men who worry about their size fall completely within the medically typical range. We are talking about the vast majority, not a lucky few. Which means the anxiety itself is, in most cases, the actual problem, not the body. That single fact reframes everything. This isn't primarily a story about anatomy. It's a story about perception, comparison, and the quiet power of misinformation. To understand why so many men feel this way, we have to look at where the comparison actually comes from. Most men have never seen another man's anatomy in a clinical, neutral setting. Locker rooms are brief and self-conscious. Textbooks are clinical and rare. So the primary visual reference for an entire generation has become adult entertainment media, a space that is, by design, not representative of the general population. Performers in that industry are frequently selected specifically because they sit at the statistical extreme, and camera angles, lighting, and editing are used to exaggerate proportions even further. When that becomes your only mental reference point, of course reality feels disappointing by comparison. It's a bit like judging your own height only by comparing yourself to professional basketball players and then feeling short. The sample itself is broken, not you. There's also a curious asymmetry worth pausing on. Surveys consistently show that men rate size as far more important to their own self-worth than women rate it as important in a partner. In other words, the people most anxious about this topic are often worrying about a standard that the people they are trying to impress don't actually hold nearly as strongly. That mismatch between perceived expectation and actual expectation is one of the more fascinating quirks of male psychology, and it shows up again and again in relationship and body image research. So now let's actually answer the question everyone came here for. What does the science say? Large pooled analyses combining measurement data from thousands of men across multiple countries give us a genuinely reliable picture, because instead of relying on one small sample or one self-reported survey, they combine many rigorous clinical studies together. And the picture that emerges is remarkably consistent. The overwhelming majority of adult men, somewhere in the range of 9 out of 10, fall within a fairly narrow and unremarkable band of measurements. The global average sits right in the middle of that band, not at some impressive extreme, just squarely average, which, statistically speaking, is exactly what most people should expect, because that is literally what an average means. But before we go further into numbers, we need to talk about how those numbers are even obtained, because measurement error is a huge and underappreciated source of unnecessary anxiety. Most informal self-measurement is done incorrectly, and incorrect measurement almost always produces a smaller, more discouraging number than reality. The clinically accepted method starts at the pubic bone, not from the visible base where the skin folds. Because there is a fat pad covering that bone in most men, an accurate measurement requires gently pressing inward until the ruler reaches the actual bone, then extending along the top of the shaft to the tip. Skipping that step, measuring only from where the skin appears to begin, can shave a meaningful amount off the true number and quietly convince men they fall below average when they don't. Circumference or girth follows a similar logic, wrapped at the midpoint of the shaft with a soft measuring tape or a piece of string, neither compressed nor loose. It sounds almost too simple to matter, but this single technical detail is responsible for an enormous share of the unnecessary self-doubt floating around online forums. Now here's where the story gets genuinely interesting. because the variation between individuals isn't just cosmetic trivia, it actually reflects something deeper about human biological diversity. Just like height, foot size, or hand span, this is a trait shaped by a combination of genetics, hormone exposure during fetal development, and individual growth patterns during puberty. Testosterone and other androgens play a role in tissue development, but so does simple genetic variation passed down through family lines, the same way eye color or bone structure gets inherited. There is no single gene or lifestyle choice that determines the outcome, which is exactly why no cream, pill, or exercise routine sold online has ever been shown in rigorous, peer-reviewed research to permanently change it. If a claim sounds like it promises dramatic, guaranteed, low-effort transformation, that claim is almost always marketing, not medicine. At the far edges of the natural range, medicine does define specific clinical conditions, but it's important to understand how narrow those edges actually are. A diagnosis at the small end is only made when measurements fall dramatically below the typical range, often linked to specific hormonal conditions present from early development, and it is diagnosed by a physician using precise clinical criteria, not casual self-assessment. On the opposite end, unusually large measurements are also rare statistical outliers rather than some hidden aspirational norm. Both extremes represent a tiny sliver of the population, which means the emotional energy so many people spend worrying about falling short is, mathematically, almost always misplaced. This naturally leads us into the world of cosmetic enhancement, an industry that has grown rapidly alongside social media-driven insecurity. It's worth understanding what these procedures can and cannot actually do, because the marketing around them is often far bolder than the clinical evidence behind them. For increasing girth, one of the more commonly discussed options involves injecting a naturally occurring substance already used in facial cosmetic work, which can create a modest, temporary increase in thickness lasting roughly a year to a year and a half before gradually being absorbed by the body. It's generally considered a lower risk option specifically because the body can break it down naturally over time. That is a critical distinction because some clinics, particularly unregulated ones, offer permanent synthetic fillers instead. These carry a genuinely serious risk profile, including chronic inflammation, lumps, tissue deformation, and in some cases permanent damage that reconstructive surgery cannot fully undo. This is one of the clearest examples in all of cosmetic medicine where cheaper and permanent almost always means riskier, not better. Length-focused procedures tell an even more sobering story. One approach involves removing fat from the pubic area so more of the existing shaft becomes visible, which can improve visual appearance without actually lengthening the tissue itself. A separate surgical approach involves releasing an internal ligament that anchors the shaft to the pelvic bone, which can create a modest visible increase while flaccid, but critically does not increase functional length during an erection and can introduce instability or reduced firmness during intercourse afterward. Leading medical bodies around the world have been notably cautious about endorsing these procedures for cosmetic purposes alone, largely because the risk-to-benefit ratio is far less favorable than most marketing suggests. And there's one more point worth making clearly: medical implants, sometimes mentioned in the same breath as enhancement, are actually a treatment for erectile dysfunction, a completely different medical purpose, not a cosmetic upgrade. Let's step back for a moment, because there's a psychological pattern hiding underneath all of this that deserves its own spotlight. Body image anxiety, in almost any form, tends to follow the same basic loop. Exposure to an unrealistic comparison creates a perceived gap. That perceived gap creates distress. Distress creates a search for a fix. And the search for a fix, ironically, often exposes a person to even more unrealistic comparisons, deepening the very anxiety they were trying to escape. This loop shows up in fitness culture, in skincare culture, and in this exact topic too. Recognizing the loop is often the first step toward breaking it, because once you understand that the comparison itself was manufactured or distorted, the anxiety built on top of it naturally starts to lose its grip. There's also a broader lifestyle layer worth mentioning, because sexual health and confidence are rarely just about a single measurement. Cardiovascular health, sleep quality, stress levels, and even relationship communication all play a far larger role in intimate satisfaction and performance than raw anatomical size ever does. Circulatory health in particular is deeply tied to how the body performs during arousal, which is one reason physicians often say that habits benefiting your heart, regular movement, balanced sleep, moderated alcohol, not smoking quietly benefit intimate well-being as a side effect. This isn't a magic fix framed as a secret trick. It's simply how interconnected the human body really is. Now for the twist that tends to stick with people long after the video ends. If you look back at ancient Greek art, at the sculptures of gods, athletes, and philosophers that are still celebrated today as the peak of idealized male beauty, you'll notice something almost nobody expects. These figures were deliberately sculpted with smaller, modest proportions. In that culture, restraint and moderation were associated with wisdom, discipline, and self-control, while exaggerated size was reserved for figures representing excess, foolishness, or crude comic relief. The standard of desirability we assume today is not some ancient, universal biological truth. It's a relatively recent cultural construction, shaped heavily by modern media, and cultures across history have defined the ideal completely differently. That alone should tell us something important, that a huge portion of this entire anxiety is inherited from culture, not written into biology. So, does that leave us? It leaves us with a simple, almost anticlimactic truth that somehow still needs to be said out loud. The overwhelming majority of men fall into a completely typical range that science has already mapped out in detail. Most of the fear surrounding this topic comes not from the body itself, but from distorted comparisons, poor measurement technique, and a media landscape engineered to make the exceptional look ordinary. Real intimate confidence tends to grow from communication, health, and self-acceptance far more reliably than from any procedure, product, or private anxiety ever could. Maybe the most useful thing you take from this isn't a number at all. Maybe it's the realization that so much of what quietly torments people about their own bodies was never really about biology in the first place. It was about the story they were told to compare themselves to. And that story, as it turns out, was never true to begin with.